Today we'll begin our lecture series on toxicology, beginning with our first lecture on acetaminophen or Tylenol. Now, acetaminophen, also known as Tylenol, is one of the most widely used over-the-counter pain relievers and fever reducers. However, it is also one of the leading causes of acute liver failure in the United States.
Damn!
Today we'll discuss its mechanism of action, how toxicity occurs, the clinical symptoms, and evidence-based treatment protocols. Let's start with the mechanism of action and metabolism. Now, acetaminophen primarily works by inhibiting the enzyme cyclooxygenase. Cyclooxygenase in the central nervous system, which reduces the synthesis of prostaglandins, resulting in analgesic and antipyretic effects.
Here I come.
Unlike NSAIDs, it has minimal peripheral anti-inflammatory effects because it is inactivated in peripheral tissues. In the liver, acetaminophen is metabolized primarily by three different pathways, first of which, glucuronidation, conjugates acetaminophen to glucuronic acid. Second of which is sulfation, which conjugates acetaminophen to sulfate. And third is cytochrome P450 enzyme pathway, specifically CYP2E1, leading to the production of a toxic metabolite called N-acetyl P-benzoquinone imine, or NAPQE. NAPQE is highly reactive and hepatotoxic. Normally, it is detoxified by conjugation with glutathione, producing non-toxic compounds. However, in cases of overdose or when glutathione stores are depleted, NAPQE accumulates, causing oxidative stress and direct hepatocellular damage, leading to liver necrosis. Now, regarding the symptoms of acetaminophen toxicity, the risk of toxicity arises when a single dose exceeds 150 mg per kg in children or 7.5 to 10 grams in adults. Chronic ingestion of lower doses in individuals with liver disease or alcohol use can also predispose to toxicity. Now, there are several phases of acetaminophen toxicity.
There's levels to this shit.
Phase 1 occurs in the first 24 hours. Symptoms can be nonspecific or absent initially, making early detection challenging. Common signs include nausea, vomiting, anorexia, and general malaise. Phase 2 occurs 24 to 72 hours. Patients may develop right upper quadrant pain due to liver inflammation, and elevated liver enzymes AST, ALT, bilirubin, and prolonged prothrombin time become evident as hepatocellular injury progresses. In phase 3, 72 to 96 hours, this is the critical phase where hepatic necrosis peaks, leading to potential acute liver failure. Symptoms may include jaundice, confusion due to hepatic encephalopathy, bleeding tendencies, and multi-organ failure. Without intervention, this phase can result in death. Phase 4 is 4 days to 2 weeks. Recovery phase for those who survive. Liver function can improve as hepatocytes regenerate, although severe cases may require a liver transplant. Now, regarding the diagnosis. Diagnosis is based on clinical history, symptoms, and serum acetaminophen concentration. The Rumack-Matthew nomogram is used to assess the risk of hepatotoxicity in acute overdose cases. It plots serum acetaminophen concentration against time post-ingestion to determine the need for antidote treatment. It's valid only for single acute ingestions within 8 to 24 hours. Regarding the treatment, there are 3 major modalities. First is gastrointestinal decontamination.
Okay.
If the patient presents within 1 to 2 hours of ingestion, you can consider activated charcoal to decrease absorption. Charcoal is typically given at a dose of 1 gram per kilogram. Second is N-acetylcysteine, or NAC. NAC is the antidote of choice for acetaminophen toxicity. It replenishes glutathione stores and enhances the detoxification of NAPQ, thereby limiting hepatotoxicity. NAC is effective if administered within 8 to 10 hours of ingestion, but can still be beneficial even after liver injury has occurred. It can be given orally or intravenously. Regarding the oral regimen, loading dose of 140 mg per kg followed by 70 mg per kg every 4 hours for 17 doses. And regarding the IV regimen, the loading dose of 150 mg per kg over 60 minutes, then 50 mg per kg over 4 hours followed by 100 mg per kg over 16 hours. Now the side effects of NAC include nausea, vomiting, and in rare cases anaphylactoid reactions, particularly with the IV administration. And third is supportive care. Address symptoms like nausea with antiemetics, continue to monitor liver function tests, coagulation profile, electrolytes, and serum acetaminophen levels. Liver transplantation is considered in cases of acute liver failure where NAC is ineffective, guided by King's College criteria. Now, prevention and public health. It's important to educate patients about the risk of exceeding recommended doses of acetaminophen, especially when using combination products. Highlight the risk of mixing alcohol with acetaminophen as it induces CYP2E1, increasing NAPQE production, and encourage pharmacists to counsel patients and ensure that products containing acetaminophen are labeled clearly. In conclusion, acetaminophen toxicity is a medical emergency but is treatable if recognized early. Understanding the mechanisms, early symptoms, and timely administration of N-acetylcysteine can significantly reduce morbidity and mortality. By remaining vigilant and educating patients, healthcare providers can help prevent severe outcomes associated with acetaminophen overdose. As always, keep your head up. You're doing great. You're better than what you were yesterday. And that's a lot. Learn something new today. Going to be a great doc. Sometimes you just got to hear that. Are you an emergency medicine professional or a medical student eager to sharpen your toxicology skills? Well, look no further. EM Toxicology Trainer is your go-to app to mastering the essentials of toxicology and toxicological emergencies. With EM Toxicology Trainer, you can dive into the mechanisms, symptoms, and treatments of common overdose scenarios right at your fingertips. Learn what happens in the body when venlafaxine levels go too high, or how to handle a dangerous Tylenol overdose. Our app makes learning toxicology easy, with concise explanations that reinforce your knowledge on the go. No more scrambling through textbooks or online searches when time is critical. Whether you're in the ER or prepping for exams, EM Toxicology Trainer gives you the confidence to tackle toxicology cases with precision and speed. Download EM Toxicology Trainer today and become the expert your patients need when it matters most. Available now on iOS and Android.